ahead and take a look at the structures of the respiratory system. We're going to first take a look at the structures of the upper respiratory system and then the structures of the lower respiratory system. This model that we see here is a mid-sagittal cut through the head. Our upper respiratory system is going to be and include all the respiratory structures up to the point where the trachea begins. So let's first identify the nasal cavity. Here we can see the nose. Just behind the nose we see the nasal cavity. The nasal cavity is split into a kind of a right side and a left side, separated by a nasal septum, but that's not one of the structures that you have to identify for your practical. If we're looking at the model here you can see the tongue, which means that this is the oral cavity here. The top part of the oral cavity, there's a roof to the oral cavity, which is bony and then soft. This initial portion of the roof of the oral cavity is known as the hard palate, and you can see the bone here that makes up the hard palate. As we move posteriorly, we're going to see some soft tissue at the terminal portion of the hard palate, and this is what we would call the soft palate. So if you were to push your tongue on the upper part of your the roof of your oral cavity, you could feel that bony hard palate, and if you moved back further, you could eventually feel that soft palate. The frontal sinus and the sphenoidal sinus, those are going to be air-filled chambers within the skull. So here we see, here's the frontal bone of the skull, and this air-filled chamber here is going to be our frontal sinus. This bone here is our sphenoid bone, and we can see this air-filled chamber here is going to be our sphenoidal sinus. The nasal concha, we can see as part of the nasal cavity, there are three protruding structures from the walls of the nasal cavity. So we've got the superior nasal concha, the middle nasal concha, and the inferior nasal concha. The next structure to move to is the pharynx, and the pharynx is what the correct anatomical term is for the throat. So we can see here the throat is actually going to start at the posterior aspect of the nasal cavity, and it's going to continue all the way down through the oral cavity and down into the area where our larynx is found. Each part of the pharynx is identified based on the region that it passes through. So the nasopharynx would be this portion here that is just posterior to the nasal cavity. The oral pharynx would be this part of the throat that is just posterior to the oral cavity. And then we have what's known as the laryngopharynx, and that is the part of the throat that is just posterior to this cartilaginous structure right here, which is known as the larynx. The next part of the upper respiratory system to identify is the larynx, which I just did, and some of the anatomical parts of the larynx. So here again we see the larynx. The larynx is largely composed of cartilaginous structures, and the largest of those cartilaginous structures are the first two structures that you have to identify under the larynx category, and that is the thyroid cartilage and the cricoid cartilage. This here we see is the thyroid cartilage. Okay, we can see it here. So this is our thyroid cartilage, and then here we have our cricoid cartilage. So thyroid cartilage, cricoid cartilage. The corniculate cartilage you can't observe extremely well. It would be in about this location here on this model, and the arytenoid cartilage would be sitting just below it in about that location. They're covered with a mucous membrane in this model. The hyoid bone, we see just a small portion of it right here. So here's the hyoid bone. The thyrohyoid membrane, it would be this membrane right here. So this is a membrane that runs the or spans the space between the thyroid cartilage and the hyoid bone. So this is the thyrohyoid membrane. The cricothyroid ligament would be the ligament that spans the distance between the thyroid cartilage and the cricoid cartilage. So this here would be the cricothyroid ligament. The laryngeal prominence, this is what is classically or commonly known as the Adam's apple. So this is the laryngeal prominence. The epiglottis is this cartilaginous structure right here that is part of the larynx. And then the vocal folds are these structures here that are part of the larynx.